Selecting the bariatric surgeon to perform your weight loss surgery is often as difficult as selecting which type of treatment to have. The type of minimally invasive surgeries performed at the New York Bariatric Group are more technically challenging. When contemplating a surgery such as this, patients need to seek out very experienced bariatric surgeons who perform this type of surgery day in and day out successfully and with very low complication rates. I would like to tell you about my background and introduce you to my colleagues and associates here at the New York Bariatric Group, who will in turn tell you about their background, the New York Bariatric Group's surgical-based long-term weight loss program, and about our special commitment to compassionate care for each individual patient's needs that have been the hallmark of our successful treatment program. I began my medical training at the New York Medical College and graduated in 1992 in the top 10% of my class. I then went on to complete my general surgery training at Long Island Jewish Medical Center. After completing my general surgery training, I went on to complete an advanced laparoscopic fellowship at the George Washington University Medical Center in Washington, D.C., training under the world-famous laparoscopic surgeon, Dr. Jonathan Sakier. I then spent some time specializing in laparoscopic bariatric surgery by training with Dr. Alan Whitgrove, the surgeon who performed gastric bypass surgery on singer Carney Wilson. Subsequently, I returned to my hometown of Long Island to start the New York Bariatric Group. I have been performing bariatric surgery for over 12 years and have dedicated my practice to the care of bariatric surgery patients. My experience includes performing over 2,500 laparoscopic gastric bypass procedures, over 1,800 laparoscopic adjustable gastric banding procedures, over 200 endoscopic revision procedures, and over 500 bariatric revisional procedures. Staying up to date on all of the newest technologies for weight loss, I was the first surgeon to perform laparoscopic gastric bypass on Long Island, the first surgeon to perform StomaFix revision surgery in the tri-state area, the first surgeon to perform the Rose procedure on Long Island, and the first surgeon to perform single incision lap band surgery on Long Island. I am the most experienced endoscopic revision surgeon in the United States and the most experienced laparoscopic weight loss surgeon in the area. I am also asked to travel around the country to train other surgeons on the single incision lap band technique which I developed. Perhaps the accomplishments I am most proud of is one bestowed by Healthgrades, the distinguished independent organization that evaluates physicians and hospitals throughout the United States. Our program was rated #1 in New York State and among the top 5% of bariatric surgery programs in the U.S. We also have had the lowest complication rates in the state for 3 years in a row. Patients who participate in the New York Bariatric Group long-term weight loss program can lose anywhere from 70 to 80% of their excess weight and keep it off long-term. We have been designated a Center of Excellence by the American Society for Metabolic and Bariatric Surgery. Our outcomes are tracked, and we are required to submit detailed records of each of our cases. You can see some of our patients' results for yourself here on our website. You can also listen to a number of our patients share their own experiences in the before and after photo section of our site.
Dr. Garber is a fellow of the American College of Surgeons, a fellow of the American Society of Metabolic and Bariatric Surgeons, and assistant clinical professor of surgery at the Albert Einstein College of Medicine. He has been nominated by Castle Connolly as one of New York's top doctors for the past 10 years. He's the only bariatric surgeon on Long Island nominated by New York Magazine as one of New York's top doctors. He's on the medical advisory board of ObesityHelp.com and chief medical editor of Bariatrics Today magazine. Our bariatric surgery program, of which he is chief of bariatric surgery, was rated as the #1 program in all of New York State with the lowest complication rates in the state by Healthgrades. Dr. Garber has been featured with Carney Wilson on the Montel Williams Show, Living It Up with Allie and Jack, Discovery Health Channel, ABC, CBS, and NY55.